Hi, Vanshika. Welcome to Resolve.
Hi, Sandeep. Thank you so much for having me on Resolve. It's such an honor and officially first ever such podcast interview that I'm doing with anybody. So I'm pretty excited and a little conscious. So let's see. So I am a nuclear medicine physician. I did my MBBS and DNB nuclear medicine, and then my own personal journey and interest took me to another branch of medicine that's called palliative medicine. So yeah, I am a consultant in both, and currently I am trying to figure out my way ahead.
Can you take us through your educational journey and why you chose to take up medicine in the first place?
Okay, yeah. So basically, I was a good student throughout in school, and biology was not so much of an interest. I was more interested in maths and computer, and I was hell bent on taking maths. But then I became a doctor only because my father really, really insisted that I go ahead and take bio. And back in the day, it was not really very, how do I put it? It was not very common for people to take both maths and bio as their major streams. You know, people used to say that if you try to take both, you are unlikely to land anywhere or be successful in either. So after studying maths and computer, say for the April-May session that we have, the primer and 11th standard, I realized that my father is so hell bent that he's not going to let me quit bio. So I might as well leave maths and maybe just choose computers because I'm really interested in that can be an optional subject. And then, yeah, because I was a good student, it just went on that I took biology and then I gave my medical entrance. I got into MBBS. And throughout MBBS, I was very, very driven about what I wanted to do ahead. So I wanted to be a doctor in the US. I wanted to be a neurologist. Brain was like my favorite organ. And yeah, so I was very sure that I want to go out of India. And for USMLE, I had to make sure that my CV is really nice and glittery, that I'm doing a lot of extra things. So other than just curricular activities, I went on to take part in research. So in my second year of MBBS itself, I started my first research project with the Department of Microbiology. And I used to go to the hospital, our hospital, the tied up hospital that we used to work in. And I used to swab people's healthcare workers' cell phones and then check the culture in the microbiology lab, how many bacteria or what kind of bacterial flora did they have. So that was basically to study the kind of nosocomial infections, what we call infections that can happen from healthcare workers to the patients. So yeah, that was how I got really interested in research as well, that it can be so interesting just to figure things out, come up with a question and then you go ahead working on it. So yeah, I went on that path to get my USMLE prep, and MBBS was done. And yeah, I did my step one. I got to US, and then yeah, life kind of changed. So yeah, I'm back to India.
Your interest was pursuing math, and
Hmm.
because of that, you decided to pursue medicine. Was there any conflict at that time? And if there was any conflict, how did you find a common solution?
Wow. Now that's so long back that I don't know exactly how did we resolve the conflict, because I'm not somebody who would just give up. But yeah, he was more actually stuck on the respect kind of thing. I mean, we did not have any doctors in our family, and he found that it's such a respectable thing and you're good at it. So once you become a doctor, only then you'll realize. So just don't leave it already. And somehow I just trusted his gut, keep and also myself, ki, okay, I can just study and get through it, so big deal. And yeah, probably that. And I just went on with it. I mean, I did not have any qualms that no, medicine is something that I really cannot do. It was more about the competition then, that what if I do not get into medicine? Maths is something which is safer, which so many of my friends are taking. uh, but yeah, now if you tell me to go back, probably I'm not going to leave maths ever.
Okay. So my next question was, in hindsight, are you grateful that dad pushed you towards medicine?
Oh shit. Yeah, so I have my days when I feel कि yeah, respect wise it's quite there, but come on, I mean, doctors being trashed left, right, center, it not being the way I mean, it's not as rosy as it was put across to me then. Also, the world has changed so rapidly that, that respect that doctor is the next to God, you just follow them. All of that has just died down. And not that I'm saying that that was a correct way to go about it, but it's become really difficult working as a doctor here in India, especially when throughout MBBS, whatever I was seeing, I just knew that I wanted to go out and study. So after that, staying here in this system has been challenging. And I have been at it because I can do it. So basically, yeah, you just do whatever's the next best thing to do.
You mentioned while you were in your second year, you also started to do your research and then spruce up your
CV, resume,
CV and
sort of.
resume.
Yeah.
Where did you get this idea from?
Yeah, so I mean, I had some seniors in my college and some known-tos who were, say, doing dental or medicine and were planning to go outside of India, but not necessarily US. But then that is how I got to know that, okay, they do research because that really adds value, because that exposes you to so many other things, the skill of doing a research in itself, writing a paper, getting publications. So these are value add things that are not a part of your curriculum. So this is, yeah, as a part of advice that by telling people that I would like to go down the USMLE route and not the All India post graduation, I got this advice ki, okay, maybe you should then start focusing on research because that is one way to enhance your resume. And I took that advice seriously, and that really worked well in my interest.
Can you take us through your process of preparing for your medicine? From what I understand, it's probably one of the hardest professions to prepare for, considering the
Yeah, I
hours.
think UPSC is one such which is really hard, and medicine is really hard in terms of it's a lot of information to be stored in your head. It's not all, especially the Indian kind of entrance exams. It is if you have read it and you remember the answer, you will be able to answer it here. It's that. So it's a lot of load on your memory, and at least at that time, physics, chemistry, bio, so physics would be a lot of solving things as well. But biology comes with so many of these terminologies which everybody is not familiar with and is not comfortable, to retain. So how do I say? I mean, people say it's a lot of about mugging. So if you can mug well, maybe you'll be able to. I wouldn't say biology is a lot of mugging, but having that very sharp memory that when something is going on, you just are able to process and say that this is the phenomenon, this leads to that. So yeah, that kind of memory retention is basically that is really required. And I think that again UPSC would also come with a lot of that because you have to be so aware about the social science aspect of it. So preparation wise, I mean, coachings, being familiar with the exam patterns, and cutoffs are pretty high is that's a problem. So for general quota, having seats in your college of choice, your city of choice, these things become difficult. So I mean, if you do not get a government seat and you have to take a private college, the fees there can be extremely high, and not everybody can afford that. So you have to take a gap year.
You mentioned remembering terminologies. Were there any tricks that you used?
Yeah, I mean, making mnemonics is something that I've been good at. So, I mean, if I have to remember, say, five, a classification which has five, so making a sentence out of the initials of those five so that I can remember it. So that sentence would be something that I created. A car is here, then A say there's a classifier, and C say there's a classifier, so something like that. So I think quite early on I picked that hack or skill that okay, that is how you remember things. So for a lot of such things, I yeah would try to make mnemonics and remember them. And I have been good actually with long words. Also, etymology is something that I found that was really useful. So if you try to break down words and one part means something, the other parts mean something, it's just easier for you to recollect later on because you've understood. It's not about remembering. So it's about you just read something and now it's something new that you already know. So it's easier to reproduce when asked.
Okay. So I hope it helps any of the students who are listening.
Yeah, I hope it does.
Did you ever get any thoughts of giving up while preparing for your medicines?
Oh, yeah. So even I had to take a gap year. So the first time, immediately after 12th, when I gave my PMT, I got a rank of 800 something in my state entrance. But even with a rank of 800, I was not getting an MBBS seat. So it was quite a bummer. I mean, okay, I'm in a 3-digit rank, but still I do not get seat because I think what 50 or 150 something was their intake capacity, and then that has quotas, OBC, SC, ST. So 800, I mean, how many people would be leaving for me to get that one college in my hometown as well? So I was again very particular that I'm not going to take a year off. So I'd already taken bio because of my father, but I did not get a seat. And I took up a seat in my local college in biotechnology because again I was quite clear that I want to go out for my masters, even if it is not doing MBBS. After doing biotechnology, I should be able to land a masters and then a PhD, probably get into research was something that was there in my head even before I get into MBBS, because yeah, it's a lot about solving things that are not known. So I was quite interested in that. So I took a biotechnology and I was in that college for I think maybe 1 to 3 months somewhere. And while I was still happy making friends there, my father again got the AIPMT's form, that next year's form you have to give. And I was like, I cannot keep doing both. So again, I'll not be able to focus on my first year here. I'll be a bad student and I'll flunk the exam, which is not acceptable. So he told me, you have to give the exam, so you figure out. And then again, somehow I chose ki, okay, fine, I leave biotechnology if you're so hell-bent on giving exam, and then let's see next year what happens. And then the next year when I gave the exam, I got a seat. So yeah.
For our viewers, what is nuclear medicine?
Okay, so nuclear medicine is, you can say, a ally of radiology in terms of doing a lot of scans, imaging, and how it's different is here we are going to inject a radiopharmaceutical material, most likely an injection. Very few scans have oral administration or any other route of administration. And this injection of a radioactive substance is now going to trace a physiological process in your body, which we'll see through a scan. So, most common indication that somebody would come to a nuclear medicine department is for PET CT scan. So, PET CT scan is a kind of whole body scan usually that we do for cancer patients. And here we try to see the spread of the disease, where all the cancer has gone. If the patient is already on treatment, how is the patient responding to that treatment, by how the disease has regressed. So it's a combination of CT, which is a structural imaging, with a PET, that is positron emission tomography, where we are seeing the distribution of this tracer. And there's so many different tracers out there. The most commonly that you will see people talking about here is FDG. So it's a glucose analog. So you can imagine, like, your brain needs glucose, right? Anything that I'm using right now is using up glucose. So that glucose molecule, everywhere that it goes, it's going to give me a distribution of where the disease is. So cancer cells, infections, inflammations, they are very highly glucose absorbing, taking pathologies and physiologies. Your brain is like the highest glucose, it relies only on glucose. So it just lights up on the scan. So we study the patterns. I mean, which is higher, which is less. If some area has less, there's probably some infarct, something going wrong in that area. If there's a mass and it's taking up a lot of glucose, that's probably a tumor, probably a cancer. So that's how it works.
Okay. So, what is your role as a specialist in nuclear medicine? Do you get to interact with patients?
Yeah, so I mean, interacting with patients in terms of why we are doing the scans for them, that's all. And what's the clinical question basically? Is this scan right for you? So, collaborating with other specialties is actually more, because how their management changes based on our scans interpretation. That is how we help other doctors. So, I mean, surgical planning. So, surgical oncology is like a friend of nuclear medicine, because for any kind of tumor, if they are going to plan a surgery, they would like to understand how widespread or extent wise where it is, what all they can remove, how can they change their approach, if at all, in surgery. Or if something is not operable at all, so that is where we intervene and tell them, no, but this is touching this particular vessel, or it's going somewhere beyond. So now this patient is not really a surgical candidate for now. They'll probably have to go through some other therapy, chemotherapy or radiation, and then we'll reassess if it has shrunk so much to now do a surgery again. So interaction with patients is basically to understand their history, why we are doing this, is this the right thing for them or not. If not, we'll have to talk to their doctor basically, that maybe it's not going to be as useful, or if there's something else we can offer. And then we get the scan done, we decide the protocol, what all areas we require, distending their abdomen, their bowel, and sometimes if it's to evaluate the urinary bladder, making sure that the bladder is properly emptied of the hot urine of the substance that we are injecting. So all of that, and then reading the scan, making the report, discussing with fellow other doctors. It's like a major chunk.
Does it ever get easy interacting with patients? Because the moment the word cancer is thrown,
Yeah.
the entire psyche of an individual and the family changes.
Yeah, of course. I mean, I used to call it the Voldemort of medicine, the C word, cancer, because you don't want to say its name. Everybody just wants to refer to it without using the word cancer. But yeah, actually, with years of being in that setting, it gets easier because now, if you have literate patients, they really know everything. So you don't really have to talk. So, okay, you've been diagnosed just now. Diagnosed with what? I can see, I can read. So it gets easier that way. And with patients who are not as aware, I mean, it's the after part which gets difficult, maybe while taking history, not as much because we are yet to get the scan and see where it is. But if it has actually progressed from a previous, or it's already in a stage which is a very bad prognosis, and they really want to talk to us before they go to their oncologist. So that is the difficult bit, because breaking that bad news comes from us. So how do we do it, and how much do we tell? And then there's family saying that no, don't tell the patient everything. So how do we navigate through these issues? This is the more challenging bit, I'd say.
And does this part drain you out emotionally?
Oh yeah. Drains me emotionally, drains most of other people emotionally, but they consider it better than other specialties which are, patient facing in terms of treatment, because then the patient comes back with how either they've benefited from the treatment or it has gotten worse. And in cancer, it's usually more grim. So comparatively, I think it's lesser draining for us because a larger part of it goes in the back end. But what I would say is ki, since I draw that gratification if I've really helped somebody in a patient, if I'm more on the back end, I'm getting drained because I'm just in the back end. So it is quite an individual approach, I would say, that being in the back end is not always gratifying for me because I never made a real difference in that person's life. So I wrote a report which somebody else will see, they'll decide, they'll manage. So it seems that I've put in so much effort, but I did not get to see somebody, being helped by that. I know in the back end it does, but yeah, personally, I feel I need more of the patient touch, that, okay, I told something, you understood, next time you come, you tell me, and all that. So.
On days when you're drained out emotionally, how do you cope with it at the end of shift, or let's say even during a shift?
Yeah, so that is very, very challenging actually, and it takes a lot of preparing yourself, going through it to really realize that you cannot carry all of those emotions. So for a very long time, I had not been able to separate my professional from personal life. So everything that I used to face in the hospital used to stay with me, and I used to have flashes of these patients and relatives also. If they're giving history about, say, a young person, and sometimes they might break down, it would be very difficult for me to console them or to hold my own tears. And then it would not leave me. So once I've gone back home, it would become a pattern that I have to tell everything, every sad story of a patient maybe, to my husband, okay, it's in my head. And then I realized it's just draining me out so much because I don't have anything else left to give to anybody, to my own friends or family. So that's the only one constant emotion that I'm going through every day. And it was very difficult to get out of it, to segregate the work and personal. But yeah, I mean, taking time off, something that my professors were good enough to realize that no, she needs a time off and you need not talk to the patient because you're not able to comprehend it. So one is acknowledging that, okay, there is a problem, I am getting really affected by it. So in that time, asking for help for somebody who can handle it better, and during the time processing my own emotions to see, okay, how do I get over it, how do I not get affected by all of it all the time. So that is a lot of hard work, I'd say. But over time, taking time off and then going back again with that perspective, telling yourself that this is somebody else's story, you are still doing your best to help them, be good to them, and then that's it. um, yes, it gets better, but it doesn't really ever go.
So the general idea is asking for help at the workplace is considered a sign of weakness for fear of being judged.
Of course.
Is that true, or what would you suggest?
Yeah, I think that is true depending on the kind of workplace you are. Plus, being a doctor or a resident in training is very demanding. So, if you're not able to, say, hold your shit together or something like that, they'll say, grow a thick skin. And these were things that have been told to me as well. But I think that is a blessing that I had some of these few people in front of whom I could be vulnerable. And because they knew that I'm good and that I'm struggling to get over these things, they were in my corner. They were not the ones who were not trusting me to be somebody, who's reliable. I mean, despite knowing everything that I can get so emotionally affected, they were still the ones who would want to hire me and make sure that after I pass out as a student, I be there because I was good. So eventually, if I'm talking to the patient, I'm so good. I'm doing my work very diligently, but it's the aftermath that I'm struggling with, which is all in me as a person. So, yeah, I mean, if you have such nice, but you'll have to build that connection repo. You have to prove yourself that, yeah, you are doing your job. And if this struggle is there, I mean, people are just human. So, yeah, you'll have to find that window with whom you can be vulnerable with, open out to them, and they should allow you that. I mean, they'll be kind enough then to let you have that time, that breather, take time off, come back, help you in ways that are possible.
Being a doctor in India is challenging. Can you take us through some of the hardships that you face?
Yeah, so the doctor patient ratio in India, one, is pretty skewed. India is so populous that we do not have as many doctors who can pay as much attention that a patient should really get. So the practice is really very busy for anybody who is doing a good job and is out there in good, say, government colleges or corporates. And the competition is also still there because a lot of them are saturated in the metros. So, I mean, if you are in a niche specialty like I am in nuclear medicine, you might still find upcoming opportunities. But then if you look at other broader specialties, maybe like ophthalm or ENT, there are just so many doctors who are saturated now in this Bangalore area itself. If you do not have it in yourself to go ahead and start a facility of your own, to get a job which is paying you well and is giving you a work-life balance as well, and is making you happy with the kind of practice that you're doing. I feel that's very rare and very limited opportunities are there. So it takes a toll. And plus, medicine is, I mean, it's gruesome in terms of the number of years that we've spent in the kind of toil that we had to go through. I'm not saying that any other profession is not as grueling, but after all of that, when you are constantly being questioned by public, by your own patients, but Google said so, but ChatGPT says so. It's like you go and get treated from them, or it's constantly trying to say why we are doing good for you, why we are thinking good for you. So it's just overall a very challenging atmosphere to stay motivated, keep at it, and then show up every day, still trying to do it for somebody in front of you and still being questioned that, are you thinking in my best interest?
Yeah. If you had to give one suggestion to patients across, not just your patients, but anybody in general, when it comes to them doing their research online and then coming back and questioning the doctor on his or her course of treatment, what would you recommend to them?
Yeah, so what I would recommend is these are wonderful tools and resources, to have the entire information out there at your hand. But sadly, this is not raising our health literacy. People are not getting aware of what can lead to what. I mean, you have all the information in terms of how alcohol is still bad for you, but you will choose that selective key, okay, this I'm choosing and I'm going to go ahead and do that. But when it comes to a medicine, you will read up for rare side effects and you will say that I cannot have this because the medicine is going to cause that. So that kind of hypocrisy, maybe just keep that at home. So for the so many other things where you're being selectively biased and choosy, it's completely risk versus benefit. You are suffering from a condition, and right now this medicine is going to help you get out of that. So you have to look at the benefit. And that is how even we take medicines for ourselves. In the current moment, this has more benefit than it can do harm. So if at all you are that rare person who gets a side effect, we'll have to learn and deal with that. And there are resources to deal with that. So you'll have to trust the doctor. I mean, if you're going to somebody, trust them that they'll take care of you. And if you don't trust them, go ahead and find somebody else. Stop doctor shopping with your half Googled information. You know, that's not going to do any good to you or definitely to any of your doctors. They'll be happy to pass you on.